Welcome back. A new state report shows some healthcare company profits are doing very well, but not necessarily behavioral health. Companies who treat those with a host of mental and emotional issues. 12 News journalist Colleen Sikora reports.
When it comes to behavioral health care in Arizona,
It's almost like you have to win the lottery to get to that next level of care.
getting that care.
I've been at this for 14 years and I personally think it's getting worse.
Deborah Giesling, a mom and an advocate to a son with a serious mental illness, says is far from easy.
It's just a very difficult process if there's that shortage of beds. And then once they get a bed, oftentimes they don't keep them long enough.
Now, a new state report showing the behavioral health care system carrying 81% more uncompensated medical care than the year before.
It's a strain on the system, and it also is an indication that perhaps those patients are not getting the care that they need earlier on in their diagnosis.
Anne Marie Alameddine, president and CEO of the Arizona Hospital and Healthcare Association, points to the report showing operating margins of all hospitals across the state at about a 6% operating margin,
Which shows, a healthy margin that can be reinvested.
but it's behavioral health care, or psychiatric hospitals, as the report calls it, that shows an unhealthy margin, less than 1%.
What does that tell you about how vulnerable that system is?
Yeah, I think the behavioral health care system in Arizona is fragile right now. And I think there's a lot of stressors on that system. And I think it's important to say that, it's in part reflective of the patient population that is also a fragile and very important community that we need to continue to meet the needs of.
As for why, Alameddine points to the hundreds of thousands of fewer Arizonans enrolled in Medicaid following the end of the public health emergency as part of the reason.
It's a fragile system that we have to make sure that we're strengthening, and uncompensated care, or ensuring that patients have access to affordable health care insurance is the first step.
Change now, Giesling says, is needed to serve the most vulnerable.
There's all of these barriers that make it so difficult to, and because they're more costly, there's just, we just tend to play hot potato. Like it's just passing them off quickly between each one. And then, if they end up in the streets because, the time ran out, well, oh, well, we tried, we did our best.
Colleen Sikora, 12 News.